What questions should I ask when buying health insurance? Buying health insurance is an important decision that affects your health and financial stability. With so many options available, it can be overwhelming to choose the right plan. That's why it's essential to ask the right questions when buying health insurance. By doing so, you can evaluate your options and make informed decisions that best suit your needs and budget. In this article, we'll discuss the key questions you should ask when buying health insurance and how to evaluate your options effectively. Why is it important to ask questions when buying health insurance? Asking questions when buying health insurance is crucial because it allows you to understand what you're getting and what you're paying for. Health insurance plans can be complex, with various coverage options, costs, and providers. Without asking questions, you might end up with a plan that doesn't provide the coverage you need or one that is too expensive. Furthermore, you may not be aware of certain exclusions or limitations in the policy that can result in unexpected costs. By asking questions, you can avoid these pitfalls and make an informed decision that meets your needs. What are the key questions to ask when buying health insurance? When buying health insurance, there are several key questions you should ask to evaluate your options effectively. These questions fall into 4 categories: coverage, cost, providers, and plan. Coverage questions. What services are covered under the plan? It's important to know what services are covered under the plan, such as doctor visits, hospitalization, prescription drugs, and preventive care. You should also understand the limitations and exclusions in the policy. Are there any deductibles, copays, or co-insurance? Deductibles are the amount you pay before the insurance kicks in. Copays are fixed amounts you pay for certain services, such as doctor visits or prescription drugs. Co-insurance is the percentage of the cost you pay for covered services after you've met your deductible. Understanding these costs can help you estimate your out-of-pocket expenses. Are there any annual or lifetime limits on coverage? Some plans have limits on the amount they will pay for certain services or a lifetime maximum. It's important to know these limits to avoid unexpected costs. Cost questions. What is the monthly premium? The monthly premium is the amount you pay to have the insurance coverage. It's important to understand how much you'll be paying each month and if it fits within your budget. What is the deductible? The deductible is the amount you pay before the insurance kicks in. Higher deductibles usually mean lower monthly premiums, but you'll pay more out of pocket if you need medical services. What are the copays and co-insurance rates? Copays and co-insurance rates can vary depending on the plan. It's important to know these costs to estimate your out-of-pocket expenses. Are there any discounts or subsidies available? Some plans offer discounts or subsidies based on your income or other factors. It's worth asking if you qualify for any of these discounts. Provider questions. Are my doctors and healthcare providers in the network? Some plans have a network of doctors and healthcare providers that you can use. If you have a preferred doctor or hospital, it's important to know if they're in the network. Can I see specialists without a referral? Some plans require referral from a primary care physician to see a specialist. If you have a chronic condition or need specialized care, it's important to know if you can see a specialist without a referral. Plan questions. Is the plan a PPO, HMO, or EPO? PPOs, HMOs, and EPOs are different types of health insurance plans that have different networks and rules. It's important to understand the differences to choose the right plan for you. What is the enrollment period? Enrollment periods vary depending on the plan. It's important to know when you can enroll and when coverage begins. How to evaluate health insurance options. Once you've asked the necessary questions, you'll need to evaluate your health insurance options. Here's how to do it effectively. Comparing coverage. Compare the coverage of each plan, including the services covered, deductibles, copays, co-insurance rates, and any limits or exclusions. Choose the plan that provides the coverage you need at a reasonable cost. Comparing cost. Compare the monthly premiums, deductibles, copays, and co-insurance rates of each plan. Consider your budget and estimate your out-of-pocket expenses to choose the most affordable plan. Comparing providers. Check if your preferred doctors and healthcare providers are in the network of each plan. If you need specialized care, ensure that you can see a specialist without a referral. Comparing plans. Compare the type of plan, enrollment period, and any additional benefits or discounts. Choose the plan that best suits your needs and budget. Common mistakes to avoid when buying health insurance. Here are some common mistakes to avoid when buying health insurance. Not asking enough questions. Failing to ask enough questions can lead to confusion and misunderstandings about the coverage and costs of a plan. It's essential to ask as many questions as necessary to ensure that you understand the policy fully. Failing to understand coverage. Not understanding the coverage of a plan can result in unexpected costs, denied claims, and limited access to healthcare providers. It's crucial to read the policy thoroughly and ask questions to clarify any doubts. Ignoring costs, focusing solely on the monthly premiums can be misleading. It's essential to consider the deductibles, copays, and co-insurance rates to estimate your out-of-pocket expenses accurately. Overlooking providers. If you have a preferred doctor or healthcare provider, it's important to ensure that they're in the network of the plan you choose. Overlooking providers can result in limited access to healthcare services. Choosing the wrong plan. Choosing a plan that doesn't meet your needs or budget can be costly and frustrating. It's crucial to evaluate your options carefully and choose the plan that best suits your needs. Buying health insurance is a significant decision that requires careful consideration. By asking the right questions, evaluating your options, and avoiding common mistakes, you can choose a plan that provides the coverage you need at a reasonable cost. Remember to read the policy thoroughly, ask questions, and compare your options before making a final decision. With the right health insurance plan, you can protect your health and financial stability. What questions should I ask when buying health insurance? Buying health insurance is an important decision that affects your health and financial stability. With so many options available, it can be overwhelming to choose the right plan. That's why it's essential to ask the right questions when buying health insurance. By doing so, you can evaluate your options and make informed decisions that best suit your needs and budget. In this article, we'll discuss the key questions you should ask when